All right, so we'll quickly look at you know we'll quickly look at the factor that's a very important factor in radiography. So it's a very important factor because you have to take care of the patient, because without the patient, the radiographer will first of all not have a job. So you are trying to do an image in a patient, but in the same plane, you are trying to make sure that the patient has the least or minimized exposure to radiation. So what is it? Why is it important? Okay, so it's actually a central principle of safe imaging practice, and radiographers and radiologists, they follow a principle which is known as the Alara principle, which has to do with as low as reasonably achievable. So you're trying to make sure that yes, you are getting the best images, but you are ensuring that the exposure to radiation is reduced, okay, to as low as possible. So strategies to reduce this exposure include appropriate exam selection. So you only performed imaging when the use for that imaging is above the risk. Okay. Then optimize technique. You have to use the correct KVPs and MAS settings, just to lower, the exposure to radiation. Then collimate tightly to the area of interest. So you just have to do it. You are trying to tailor your imaging just to the place where interests you, and just to the place where you know that the imaging there is actually needed. Okay. So digital system optimization. This is where you now look at all those monitor exposure indicators to avoid dose creep or dose becoming so much. The patient should be properly positioned. Why? Because you don't want to image, then later you're now saying, oh, this imaging was not right, let's go back for another one. You understand? Then shield. Okay. Try to reduce exposure of other areas that are not of interest, to that particular imaging. Okay. So use post-processing tools to enhance image quality. Patient position should be accurate, shielding, education, and training. So the radiographers should always be updated on the right, radiography practices and the rest of it. So risk of poor practices is if you do it wrongly, there's a risk of the image will be repeated later. Also dose creeps in digital radiographies and the rest of it. Okay, so this is what we got for minimizing patient exposure, radiation exposure.